We're here in the CMH operating room, and I'm thrilled to have with me Dr. Jason Bailey. He's a new critical care pulmonologist at CMH. He sees patients at the CMH Pulmonology Clinic and also takes care of critical care patients in our ICU.
So anyone that's short of breath, whether it's COPD, asthma, or undiagnosed lung disease, I see them in the clinic. We do testing to try to figure out exactly why they're short of breath. And then I also work in the critical care unit. I'm a critical care intensivist. So anybody that's on life support, anyone that's real critical, I help get them better.
Excited about some of the new procedural services that you're going to bring to CMH, specifically the ion procedures and the Zephyr valves. And so I think people would like to know about what that involves and how that helps patients. So could you tell us a little bit about ion and the Zephyr valves this morning?
Yeah, so ion is robotic bronchoscopy. It has shape sensing technology. We can reach the very difficult to reach places in the lungs, whether it's in the very periphery of the lung or even next to the heart and the great vessels. And with this technology, we can navigate the airways to get to these lesions to biopsy them. The goal is to diagnose lung cancer at a very early stage so it's more curable. And so when a spot on the lungs is detected with screening CAT scans, then the patient comes to me, we work them up, we schedule an ion robotic bronchoscopy procedure, and we navigate to that spot and we biopsy it. With the ion, there's no incisions, it's minimally invasive, it's a very low risk procedure.
Let's talk a little bit about the Zephyr valves and what you can provide for patients with that service.
Yeah, so COPD, it's a chronic progressive lung disease. It's not curable, and because it's progressive, patients tend to get worse. Usually COPD is caused from smoking. There's also hereditary types of COPD as well. With COPD, we have breathing treatments, we have inhalers, but really those inhalers, they only increase the lung function test by like maybe 3%. With the Zephyr valves, it's doing a bronchoscopy. It's going in through the mouth down into the lungs, and we can place these valves. The valves actually can improve the lung function by up to 30%, whereas inhalers can improve the lung function by 3%.
That's incredible. I'm sure there's some criteria for who would be a good candidate for this procedure. Talk to us a little bit about that.
Yeah, so the procedure is approved for severe COPD, and it treats hyperinflation. With COPD, it's an obstructive lung disease, so patients have a hard time exhaling. Because they cannot get all their air out, their lungs continue to get larger. It compresses on the diaphragms don't work well, and that's what contributes to their shortness of breath. With the one-way valves, with the Zephyr valves, we place these valves and it reverses the hyperinflation.
I have a family that has suffered with COPD and can personally attest to how any increments in improvement in breathing can make such a difference. But to move from 3% to 30% is life-changing. As you can see at CMH, we're continually growing, adding services, adding new physicians, adding the latest technology, and this really is what Dr. Bailey is bringing to CMH and to our communities, is truly game-changing in terms of the level of care we can provide for patients that have pulmonary disease or patients that are in our ICU needing critical care. And so I'm really excited about having you on our team, Dr. Bailey. I'm excited about the care you provide. I've already heard patient testimonials about the great care that you're providing at CMH, and this is just another part of us continuing to evolve and grow, to be better able to take care of our communities in the future. So we welcome you. We're glad that you're here, and so excited about these services that we're providing here at CMH.
Thank you. I'm happy to be here.